Hi Rebecca, it's Siobhan here. Thank you so much for joining me to talk about sexually transmitted infections for Women's Health Week.
No worries. Thanks, Siobhan, for asking me.
That's okay. So first off, what is a sexually transmitted infection?
Sure. So sexually transmitted infections or diseases are passed on during unprotected sex with an infected partner. This includes vaginal, anal, or oral sex. Some STIs can be passed on by just skin-to-skin contact. And some of those sexual activities actually includes kissing, touching, rubbing, using sex toys, intercourse, or oral sex.
So what would you say would be some common STIs?
Yeah, the most common that we're looking at these days is chlamydia, gonorrhea, genital herpes, and genital warts.
Yep. Is there any kind of less common STIs?
Yeah, there are, and we do still see them, but they are less common. They're syphilis, human immunodeficiency virus, or known as HIV, pubic lice, or pelvic inflammatory disease.
Who is more at risk of getting an STI?
Yeah, so you're at risk of getting an STI if you don't use condoms during sex or dental dams, which are thin latex square held over the vagina or anal area during oral sex. You also are at risk if you have a changed sex partners or had more than one sexual partner in the last year. You or your partner could also be at risk if you share injecting equipment such as syringes and needles. And also, you or your partner are also at risk, or yourself, if you have other sexually transmitted infections as well.
So if I was to have an STI, what would the signs and symptoms be?
You know what? By looking at you, Siobhan, today, or any person that walks in this door, we actually can't tell. So nobody walks around with a neon sign going, bing, 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 I've got an STI. A lot of people actually don't show any obvious symptom at all. You can actually feel perfectly okay and not realise you have an infection. But even if you don't notice any signs, the STIs could still be making you actually really sick. So if you look at us in women for Women's Health Week, 3 in 4 women who are infected with chlamydia, which is one of the most common STIs we talked about before, actually shows no early signs or symptoms at all. But if you did, and look, some people do show some signs and symptoms, sometimes it can be unusual vaginal discharge, it can be difficulty or pain when you go and do a wee or urinate, and also pain during sex. Sometimes you get blisters or warts or lumps and bumps or sores on the actual genital region. Also, some people can have a rash, they can have cracked skin or itchy or irritated skin on or around the genital region. But having some of these signs or symptoms may not mean that you've got an STI.
Okay. How does someone know if they have an STI?
So if you notice any of the mentioned symptoms, or if you have sex without a condom or a dental dam, you and your sex partner or partners should seek advice from a sexual reproductive health nurse like us at Bendigo Community Health or your GP, and get an STI check. Depending on your particular circumstances, this may actually involve a urine sample, a swab, or a simple blood test. The earlier you are diagnosed with an STI, the earlier it is to treat, which also reduces the chance of developing further health complications, and especially for women, pelvic inflammatory disease.
Yeah, so my next question, I guess, is how do you get tested for an STI?
Yeah, so when you come into our clinic or any clinic, basically the simple way to test for an STI is we ask women to urinate into a jar. We can ask you to take a swab of the inside of your mouth, or us clinicians do that swab for you. We also may swab the genital region because if you've got some discharge there, we actually need to send it off and to see what sort of potential STIs are growing. Also, any swab of any discharge or sores we would actually potentially do as well, and also a blood test for the blood-borne viruses like HIV. And also, in a blood test, we also determine syphilis as well. which is becoming more prominent too.
Yep. So how would an STI be treated?
So many STIs are successfully treated with antibiotics. Others can be managed with certain medication. So some STIs can damage a woman's reproductive system, such as pelvic inflammatory disease, or some women may know this as PID. And this actually means it could cause problems in having children in the future if you choose to. And also sometimes that PID can actually cause you to be infertile, meaning you can't have children at all. So my big question too is, do you need to tell anybody? And the answer is, yeah, you do. So if you have been treated for an STI, it is really important to let your sex partner or partners know so that they can get tested and treated too. Because if you get treated and your sex partner doesn't, and you go back and have sex with them, you're just going to reinfect yourself again and put yourself at risk. So at Bendigo Community Health Services, we've got the sexual health nurses and GPs that are really skilled and trained and create a very warm and nurturing, confidential and private, and maintain your privacy at every cost. However, when we do need to inform your partners or partner, and you may not feel comfortable to do that, us nurses, the sexual health nurses or the GPs, can support you in doing this, and that's what we call contact tracing.
So how can someone prevent from getting an STI?
Yeah, so you can reduce your risk of getting an STI by having regular STI checks. That's really the main key point that we want you to take away today. However, if you limit your sex partners, the fewer people you have sex with, the less chance you are going to get of having an STI with someone who is positive with an STI. However, we know that's not realistic, so for some people, and therefore we promote always use of condoms or dental dams, and water-based lubricant is really important. And condoms is really the best way to protect you both from an STI. The other one too that I suppose I'd really like to let people know is that learning to communicate is with your partner about sexual health stuff is the key point. You be open with your sexual partners. It's okay to ask them, have you ever had an STI? When was your last one? What was the result? Did you get it treated? Because if they didn't get treated and they were positive, then you really need to make sure that occurs first. If there's any signs of an infection, like rash or sores or discharge, don't touch or rub the area. Don't have sex until you actually come in and consult with us sexual health nurses or GPs. The other really important point too is that I'd like you to make sure you check the use by dates of condoms or dental dams, because they can actually deteriorate. They're rubber, so they can actually deteriorate in heat, and especially if we leave them in our cars, in the glove box or the back pocket of our wallets or purses. Also, making sure that the use by dates on the dental dam and water-based lubricants as well is really important. So the other one, don't use Vaseline, don't use massage oils, as they weaken the condom and dental dams as well. So once again, using that water-based lubricant.
So Rebekah, what are some other ways that you can prevent from STIs?
Yeah, so there's also the vaccine that boys and girls do get in their secondary school age, mainly in year 7, and that's what a lot of people know as the cervical cancer vaccine. But in that vaccine, it's also got protection against genital warts, and that's actually going to protect women and men against genital warts by 90%. Now, that's just mind-blowing. That is the best STI prevention vaccine that we've had in Australia. So highly recommend everybody to get the HPV vaccine when it comes to you at school. The other one too is that what's really important about that vaccine is that it's actually given before they become sexually active, or else the vaccine won't actually work or will be less effective. So I suppose what I really want people to take away today is, how are you going to prevent these STIs if you're going to be sexually active? Because we're human beings and that's what we do. So get a sexual health check every 3 months, especially if you have sex with several partners or frequent partners and you're changing partners. That's really important. However, if you're under the age of 30 and you have one partner, we usually recommend once a year is a really good idea. And for everybody else, the same applies. If you're changing sexual partners, doesn't matter how old you are, come in and get a check. How hard is it? Pee in a jar, not that hard. and we're really friendly sexual health nurses. Basically, the other one too, if you notice any signs or symptoms, so you don't wait for that once a year check or every 3 months. Make sure you come and see us. So if you've got a ulcer sort of looking thing on your genital area that you want somebody in a confidential environment and supportive environment to check it out and give you reassurance, come in and see us. Don't leave it. Just come in and get reassured. I think that's really important. And the thing is, at Bendigo Community Health, we've got sexual health nurses that specialise in this area, and the GPs as well. They're just, we're such an amazing team that I think nobody should resist coming in because they're concerned about that. You will get a friendly smile from the front door from client services, and they will maintain your privacy as well.
Great, thank you.
No worries. So thanks for listening to us today. So make an appointment. That's the main thing. And the other one too is there are some really good resources and some other places to check out. So we'll pop them up and you can have a look and you can go to them at your leisure as well.
All right. Thank you so much for information. It was really helpful.
No worries. Thanks, Siobhan. Thanks, everybody.
Bye.
Bye.